today we're going to go through an educational video on how to set up the Glidescope. So Glidescope is good if you have somebody you think is a potentially difficult airway. So this is the machine here. This is the power button, and you just hold that on. The important thing with the Glidescope is you should try to make sure that it's plugged in, because it will run out of battery, and often right when you're in the middle of an intubation. So once it turns on, the camera is right here where the light is. So what you want to do is you want to take this and you want to put it in one of these disposable Glidescope stat packages. There's a 3-stat and usually a 4-stat. For most women or people who are not excessively tall, we prefer the Glidescope 3. So you open the package like so. And then it would just slip in like this. And you keep the package for when you're done intubating, and it would go back inside. Okay, so at this point, you can see the screen is seeing whatever this little camera here is seeing, whether that be in the patient's mouth or not. Okay. Other kind of important things to make sure it's firmly down. And if this looks blurry at all, it means that probably this camera here is dirty and just needs to be cleaned, or some dirt on this camera here. So that may happen. And you can just take a little gauze and clean that. In terms of when it's not in use, just keep it in the package. Most people, when they intubate, use a Glidescope stylet for their tube, and load their tube on one of these. Now these are quite stiff, and they need to often be lubricated before putting in a tube. And sometimes you don't recognize that you may need the Glidescope, so you may actually have to help the anesthesiologist out by getting a tube ready. So in this case, what you would do, tube, is grab, usually for a female, a size 7 endotracheal tube. And then what we'll do is grab some gel and just put a little bit of gel on the package. Take the tube, make sure it's lubricated along the metal, and then you would just slide it into the tube and push that down all the way. Okay, and then a few times just to loosen it. Otherwise, there's nothing worse than when this goes through the cords, when you go to take it out, accidentally extubating the patient. So then just kind of how it would work. So you go to intubate your patient. So the anesthesiologist usually does a 2-step technique. So the first is putting it in the mouth under direct visualization. At this point, there's no point in looking at the camera. And then once it's in the mouth and you go around the cords, then you look at the camera. So you want to make sure that wherever this screen is visible to the person who's intubating. There's nobody in front of it, as well as people are not turning back to look at it. Once you get a view of the cords, as you can see there, then it's important to pass the tube. The tube would go in kind of on the side, again in a 2-step process, go through the cords. Now for removal of the stylet, I'm going to show you, usually we have an assistant. The tendency is to want to pull up. However, the Glidescope stylet is fixed and curved, so you want to aim towards the patient's feet, and that helps take the stylet out. And then that would get pushed in and put into position and taped. And then once that's done, again, like we said, to save our Glidescope package, we just put that like that and keep that aside on the anesthetic cart so that doesn't get thrown out in case the patient needs to be reintubated.